Hi, my name is Jimmy Locklear. Welcome to my Kickstarter project for publishing my book, Sacred Heart Attack. I experienced a heart attack earlier this year in 2013 in Montreal, Canada. I'm currently in Decatur, Georgia, and have been journaling about my experience as a patient going through a heart attack and being treated for that in the emergency room and the operating room. And some of my friends really were fascinated by my story, and so they wanted me to publish it in a book, and I'm now in the process of doing that, and I'm needing some help in that launch. Since I'm a first-time author, it's not common that first-time authors get big publisher contracts or book contracts. So it's something I've been wanting to do for a while. Write some books that could be published. It's the combination of feeling like you have something to say and there being an audience, a group of folks who are responding to the things that you've been writing, and that's been my case. I thought I would read a couple things from a couple of passages from the book that might give you a little bit of a flavor of it. As I said, I went into a hospital in Montreal, and shortly a triage nurse motioned for me to enter her office. It seemed like she quickly assessed what was happening. I handed her my passport, insurance card, and a few medicine bottles I had in a plastic bag. She asked if it was okay for Kurt and Nathan, some friends of mine who had brought me to the ER, to complete the paperwork. I said yes, and she said, "You come with me." We stepped into a larger area with lots of activity. Dr. Garner asked me to describe my pain and how long it had been going on. After a couple of diagnostics, he asked me to get undressed and lay down on the gurney. Shortly, Dr. Garner said, "I'm sorry to say you're having a heart attack, probably from a blood clot. We're going to try to find it. You should have come in earlier." I'd been having chest pains pretty steadily since about 3 p.m. It was now about 6 p.m. I had no idea that the artery that was 100% blocked was the primary delivery artery of blood and oxygen to my body. I was experiencing an acute anterior wall STEMI, or anterior myocardial infarction, that results from the occlusion of the left anterior descending artery. It's a major heart attack, pure and simple. I was stunned, but not really surprised at that point. What else could it be? I had tried to address occasional chest pain for a couple of days as symptoms of esophageal reflux. A young man in medical scrubs asked me to open my mouth. He then sprayed nitroglycerin into my mouth to hopefully dilate my arteries. A woman pushed a needle into my arm to start an IV. The nitro sprayer guy asked if I was feeling any better. I said no. Another woman with a long needle asked if I had any allergies, then wiped my belly with alcohol, then punctured the skin to quickly thin my blood. I didn't even feel the needle. Soon I was rolling to the operating room. It was colder, and I was now completely naked except for my watch, my hipster glasses, and a blue Sacred Heart Hospital ID bracelet. Two kind people lifted me by the sheet under me and transferred me to the OR table. One nurse was shaving my groin area and my right wrist so that the doctor would have both options for doing the impending angiogram. Another lady was adding another IV and taping the oxygen monitor to my left index finger. Lying completely flat on a metal table is not comfortable, but the pain in my chest was relentless. Shortly, the nitro sprayer guy came by again with a cup with about 6 pills in it. He held my head as I swallowed them and chased the brown round pills with a small amount of water. He said they were for the pain that I had earlier indicated was a 10 on a scale of 1 to 10, with 10 being, I think I'm going to die. If I was trying to take a breath and see if the pills worked, hoping the pain would subside, then what happened next made sure I was wide awake. A female nurse said, "This is going to be cold." She then began to paint a slushy-like mixture of iodine and alcohol, and I think ice shavings, although I don't think they were there, all over my stomach, waist, groin, upper thighs, and then my right wrist. Her warning about the cold was an understatement, but relatively speaking, not a problem. That was followed by fabric adhering to my skin and paper being spread over most of my body. Someone then put what looked like a clear plastic shower cap over a shoebox-sized white ceramic device that hovered just a few inches above my head. Dr. Sharon soon introduced himself and said that he was going to find the clot and unblock my artery. He seemed energetic, enthusiastic, and eager. I thanked him, and he proceeded to make a small incision on the inside of my right wrist. My wrist was clamped and bound tight to the table. Next, I felt a tube being inserted into my arm. You get a sense of how detail-oriented this really is, the story that I'm describing. Since I was wide awake, and it was such a dramatic event, I've had no problem sort of recalling exactly what took place. And I want to share that with you because I think you'll find it to be somewhat inspiring, certainly informational, educational, and it could help you or someone you love in the future. So if you join in this project, I'm making available some different signed copies of the book, which you'll see on the Kickstarter site. And thanks for checking it out. Thanks. Bye.